So I'm really excited to talk about what I believe is a new golden era of drug development and treatments emerging in our myeloproliferative neoplasm space. The reason for that optimism is I think that we have four major classes of drug development now here to stay. The first one is in the JAK inhibitor space, as we do have several other agents in active development for JAK inhibition beyond the four approved. And some of these now are becoming mutant selective or mutant specific. So those are just entering phase 1 clinical trials, and we're eager to see those clinical data. A second aspect of drug development that's been very exciting is immunotherapy, so targeting the immune system, especially in myelofibrosis, in which the only curative therapy remains allogeneic stem cell transplant, the original immunotherapy, if you will. It's been exciting to see new targets unveiled by our science colleagues, and one of those happens to be CALR, the second most common driver mutation, all the MPNs. Because the CALR, the mutant CALR, shuttles to the surface of the cell, it appears amenable to immune attack, and now we have a host of vaccines, CAR T cells, monoclonal antibodies, and bispecific agents all in active development, either in preclinical or in phase 1 trials. Yet a third area is that of novel agents beyond JAK, which is really this exciting area in which there's really a new drug, essentially weekly or monthly, coming out into clinical trials. Some of those are targets that have been around a while: telomerase inhibition, CD123 inhibition, BCL-XL, bromodomain. Some of them are a bit newer in the MPN field, XPO1, for example, MDM2 inhibitor, and others. And several of these have actually entered into active phase 3 clinical trials, either as an add-on strategy to JAK inhibitors or, in fact, as a combination up front. And then finally, a very important area is that of anemia in myelofibrosis. So now we have a sea of new active agents coming out that are trying to specifically target the anemia of myelofibrosis and either adding disease modification through the drug itself, so spleen, symptom, and anemia, or combining it with the JAK inhibitor. So basically, that's what's going on in the field of novel targeted therapies for myelofibrosis. And we really are excited to await the clinical trial data over the next few years to see where we are as a field.